Borno, Adamawa, and Yobe governments have embarked on measures to ensure that they ameliorate the current hardship on citizens caused by the removal of petrol subsidy. In Borno and Yobe states, the distribution of palliatives to households has commenced, while in Adamawa, the committee constituted for the exercise is still working on modalities.
The Yobe state government has distributed food items to 6,800 less privileged persons in Potiskum Local Government area of the state. Dr. Mohammed Goje, the Executive Secretary, State Emergency Management Agency, SEMA, stated this at the inauguration of the distribution exercise on Wednesday in Potiskum.
Goje noted that the distribution began since the pronouncement of subsidy removal by the federal government, adding that it is an ongoing state-driven initiative that will continue. Also adding that more communities will be reached out to. We're now joined by Alistair Wilcox, who's a financial analyst and the immediate past chairman of ICANN Lagos and District Society. Good morning, and thank you very much for joining us.
Yeah, good morning for having me. It's my pleasure.
All right. Let's get into the conversation this morning. Share with us your thoughts on the current palliative distribution. It, of course, came up because we're trying to ameliorate the hardship that the removal of fuel subsidy has caused Nigerians. Do you think that it is fulfilling the purpose why it was being established?
Well, I hope you can hear me clearly.
Loud and clear.
Okay, thank you very much. I have never been a fan of handouts in the name of palliative. Sincerely, yes. We know that at every point in time, there will be the vulnerable in our society, that certain items, certain direct intervention in terms of items and distribution of maybe food, as is done in every other countries where you have food banks, food stamps, and supplements. Yes, those are some of the things we've copied from the Western world. But sincerely, I'm not a fan of sending out handout to people in the name of palliative. The truth of the matter is, and we must ask this question, for how long can that be sustainable? Now, first subsidy removal is gone. I mean, it's something that the government has taken away. So everyone must come to live in terms with it. Now, whatever thing we are doing now, for me, it's like a drop in the ocean. If we begin to say we are rolling out palliative, and then the palliative is to share food items, so the so-called vulnerable. For how long are you going to share food items? Now, if you give a man even a bag of rice, like what I'm seeing on your screen right now, how long will he eat that? And then we are talking about a program, a situation that has gone totally. We're not going back. I don't think anytime we're coming back to introduction of fuel subsidy. So it is just the same thing. Comme ça. Anytime government does a kind of a policy of this nature, they roll out some palliative for a few days, use that to assuage the people, and then everyone get back to business. Because you will not, if you feed them today, you will not feed them tomorrow. And there's this adage that says, if you give a man fish, you just feed him for one day. If you teach a man how to fish, you feed him for life. So I think we should be looking at a sustainable way of ameliorating such things whenever they come about. Yeah, a sustainable way. What are the fiscal intervention, when I mean physical policy intervention, that will assuage these things? Because already we must identify what are the real effects, not this cacophony of voice effect. What are the real effects? Who are those real effects? I mean, talking about fuel subsidy removal, I agree it will affect every facet of our life, but what are the real effects? They'll begin to direct policies directly to mitigate those effects. Then it will become long-lasting. It will become what I would call, it will become sustainable, and not this ad hoc palliatives. For me, it's just plain to the gallery as far as I'm concerned.
Yeah. Now we're talking about northern Nigeria, because we can spread the conversation across the country and ask if the government is not aware that this was a bad decision, or who is advising the government in this regard. But I want us to look closer at northern Nigeria, Yobe and Borno State, and a couple others that have been mentioned here. What would you say should be the focus of these states? If you're given 5 billion naira per state in Borno and Yobe, for example, what should be the focus for those governments in order to at least make the people feel seemingly better, since the petrol subsidy removal? Should it be rice and onions and oil? Or is there other ways that they maybe can channel that money?
Exactly what I'm saying, my dear brother. But let me correct one question. It's not a bad policy. We have lived with this back and forth fuel subsidy removal issue for too long in our body politics. I think Nigeria is about one of the last countries still subsidizing fuel. If you look at our neighbors, nobody subsidizes fuel. Market forces drives it. But is that the way it was done? Was it the best? The answer is no. I would not have expected it to have been done the way it was done. But of course, it was a mistake, and which we are now fighting, because the Bola Tinubu I know, the President Bola Tinubu I know, is somebody that thinks through policies, thinks through, and look at all sides of it. So was it the excitement of being sworn on the 27th, on the 29th of May that made that pronouncement or whatever? But we have come to that point. So we've already crossed the bridge. Now, what we're supposed to do is to look for what to do. Now, with respect to your specific questions, I don't think it is sharing of rice. Look, the Adamawa, the Borno Yobe area, they are the rice producing area of the country. That's what I'm saying. Look, when we are talking about intervention, we must be able to analyze. That's why today we have armchair governance. And it's sad for me that Professor Zulum, who is being, yes, I agree, there must be this paparazzi of showing that the government cares by sharing those kind of items and goods, but that is not the sustainable way. This, of course, we must display the camera to the camera for people to see. There are over, Borno has about a population of about 3 to 5 million. How many people are you going to give such rice and such ororo and such granite and such what they call it, onions and everything? How many people will you cover? It will breed corruption. It will bring whatever. Borno, it's a farming community. Yobe are all farming community. Now, if that money is invested heavily in agriculture, subsidizing whatever costs they are having in terms of the agricultural input and output, providing, giving them some agriculture extension services, direct agriculture extension services in terms of tractors, in terms of all this that they will need to produce more. So I think that is a better way, because they are already an agrarian society. So the fuel subsidy affects the man in the village the way it affects the man in the city of Lagos that commutes to work every day. Of course, the answer is no. So if anybody even needs palliative now, it is the man in the urban city that will use transport to work every day, for which he has to pay more in fuel. Does it affect the man in the rural community that treks to his farm, that is living around his farm and everything? Does it affect the way it affects the man in Lagos? The answer is no. So we must be able to analyze, critically analyze, and that's why I said the policy could not have come to affect the way it comes to effect after, if due critical analysis has not been done. Now, state governors that will receive, now the good part of the policy is the fact that a lot of money will be free, a lot of cash will be freed. We have seen it displayed in the revenue, in the FAC distribution for the month of June and July. We saw a humongous lift from what it used to be to in trillions. So now the country makes trillions of naira in terms of revenue. And you see them sharing since we close of 900 billion. That has never happened before. So now the state government have more money. The federal government have more cash that will be directly invested, which we always hear, in critical areas that will ameliorate their problem. For instance, what Lagos is doing, Lagos has subsidized transportation. Even though that is for the government, even though the private ones are still running riot with whatever cost they are charging, very, very exorbitant, and they're not able to rein them in Lagos, but they've subsidized their own transportation, which is a direct impact that will affect thousands and millions of people. They have also gone ahead to say certain services provided by hospitals are free. Delivery, antenatal, all the maternal issues are free. Direct intervention. So I will want more intervention, maybe reduction in tax rates, giving of rebates, not to share rights, because
maybe with, also with
fraud and suspicion and irresponsibility, and it is not sustainable. So if you do those things that is sustainable with the excess cash you have, increase worker salary, direct cash transfer to the vulnerable, the really vulnerable that you have identified. Direct cash transfer, because there's excess money. You engage in public works. You engage in public works, whereby you employ more people and pay them so that they can live. You engage in gutter cleaning, opening of drainages, direct public work. What do you call it? Direct agriculture, like what happened in River State some time ago, school to land program. These are the things I expect government to do with the excess money that they're having.
I think we might also be suffering from
of sharing rice.
Yeah, Mr. I think we might also be suffering from lack of proper structures, that will make these things easy to spread around. Because if we had like a proper transportation system, then you can, give, citizens free transportation for 3 months. The government will fund it, and everybody who gets on a bus or gets on a train doesn't need to pay. Lagos is just about setting up, or I think the blue rail lines is starting off this week or next week. If you make that free for a couple of months, the government can afford it. But not every state has those facilities or those, level of infrastructure. You're talking about free health care now, or free maternity or antenatal care. Not every state has those things, on a level where they can make it free and let people, access them. So we maybe need to fix those structures and fix those institutions first before we can then take advantage of them and use them to make life easier for people. But another thing that I want to ask, and I think I had brought this up earlier this week, is when we know that, there are fears that these state governments, of course, will not use all of the 5 billion naira for its citizens. A couple of, parts of that money will be siphoned left and right. Those are, of course, the expectations Nigerians have. Do you think that the Tinubu administration maybe should have used this money for something else entirely, instead of just sharing it across states?
Well, let me also say this. I wouldn't agree totally that the states do not have physical infrastructure to drive them. There's no state that doesn't have hospitals, no state that doesn't have healthcare facilities like Lagos. Lagos is not the least state, and no state that do not have transport system. For instance, Oyo State, and I wouldn't say free. Sincerely, this issue of saying free, no, I wouldn't say free. I would say heavily discounted, like Lagos did. Oyo State has just launched their own bus system. They have bus system in Oyo State. I live in Ibadan. So many states have.
When I'm talking about infrastructure, apologies. When I'm talking about infrastructure, I'm saying, for example, if you go to Edo State now and say, okay, you have a public transport system, a couple of those big, they call them Oshomole bus back then, and say, okay, these buses are going to be subsidized, are going to be free for the next 2 months. Let's even make them free. They don't even have enough buses to carry the amount of people that want to ride those buses for free. That's what I mean by, lack of that structure. If you say healthcare is going to be free, how many primary healthcare centers do you have in every local government to address the number of people who really desperately need subsidized healthcare and cheaper healthcare, even free healthcare? You don't have enough. And that's what I mean by we don't have the infrastructure.
Yes, I agree with you. Nigeria as a whole do not have enough of anything. So the least you have, at least if you can benefit a majority, I think if you can benefit a sizable majority, a sizable group, for me, you have done noble. I keep saying, I'm an accountant. Nothing should be free. Even in Freetown, there's no free lunch, even in Freetown. So it should be heavily subsidized. And the states that are doing it, kudos to them. But it should be on a sustainable basis. I'm not praising Lagos. Lagos can do more, but I know that Lagos have staff buses for their workers. They have provided BRT. They are not doing the blue. So I'm not praising them. I know they can do more with what they have, but at least it's a good start. And a lot of people today are testifying to that fact that at least they have cheaper government transport system. It's for them to rein in the private ones. Even the private ones can do a bit of that. Unfortunately, we don't have costing method. We just do our pricing method is just we see what's it. But let me say this: with respect to the Tinubu administration using the money in the other thing, there is no way the federal government can use the money alone. Unfortunately, the states governors are the weakest link in our national development because they are not challenged. Imagine you're also making that mistake. You are thinking that Nigeria starts and ends in Abuja. Nigeria is a federation, and there's no way the Tinubu government can use the money in the federation account by himself. There's no way the federal government, the money must be shared according to the revenue allocation and formula. It
All
must
right,
be
Mr.
shared.
Wilcox,
The
we'll
federal
have
government
to
cannot sit on the money.
we'll have to interject at this point because we do have.
So what I'm saying in essence is that the money must still go to the state. Let me just finish this, please, quickly. The money must still go to the states. And it is you and me, the media and the press, that must be putting searchlight on the state and local government to use this money properly. Because all along, what we do is to only blame the federal government, look at the federal government. We leave the state to run riot, to run amok with the resources that they have. Billions of naira in the state, trillions.
We certainly will project that.
Them accountable until they run riot.
Right, Mr. Wilcox, thank you so much for your time with us this morning. We unfortunately have run out of time for that conversation, but you've so clearly highlighted your standpoint. And yes, we will continue to search, point these lights and use the beam lights to search how these funds are being used. Thank you so much for joining us, and do have a wonderful rest of the week.